what led you to the decision to use cannabis? Were you ever a cannabis user prior to this? What were your thoughts?
So I used cannabis recreationally 2 or 3 times a year, maybe.
Okay.
But what led me to use it for this cancer diagnosis in particular is that my dad, just by coincidence, about a week earlier, a very good friend of his, he was over at his house, and this friend had been diagnosed with lung cancer years before, but he was given months to live.
Yeah.
And one of the things that he thinks, and he's still with us, one of the things that he thinks has helped him through all of this is cannabis. He grows his own, makes his own oil. And so he happened to have brought my dad downstairs a week before, even though he'd been using it for years before that. He decided that week, that's the week he was going to open up to tell their friends and neighbors about it.
With that, when you get your diagnosis and you and your husband are in your doctor's office and you get this diagnosis, or wherever you learn, I'm certain they didn't send you the results. You had to come in and get the results.
Yeah.
And then did you right off the bat, you and your husband said, let's get on cannabis? Did you share this with your doctor, your oncologist? Where is your oncologist now on board 2 years later, and where you are I guess in your diagnosis, and did you do any conventional type of medicine?
I did, yeah. So when my dad came to me and said, "You got to try this cannabis to help my friend," I was a little bit resistant at first. I listened to my oncologist first. I kind of had my game plan going with that.
Yeah.
But my dad, he wanted to help. He wanted he didn't want to see anything happen to his daughter, right? And so he went out and he bought a tent and he hired somebody to grow it for me, whether I agreed to it or not. But by the time I had decided that yes, I was going to do that, I did talk to my doctor about it, and I asked him if he had any problems with it. After first talking to a few other people, and he was not unsupportive. He didn't tell me to go out and do it right away, but he kind of had a sure, do it on your own time, I don't want to know about it kind of attitude about it.
This is your doctor or your dad?
My doctor. No, my dad was really all for it. Yeah.
It's funny because we still work with a lot of patients and their doctors, but they would say, my like perfect example, my aunt, Lois, I'm going to act like you didn't ask me that question.
Right. Yes.
Or if you use cannabis, I want you to find another doctor. And we've done this in retirement communities. And I said, what'd you do? And this is the 80-plus-year-old woman. She goes, I fired my doctor. And we all chuckled, but it is the truth. It's like, this is your body. You need to, especially when you're going through something, you need to have the support system and positivity wrapped around you. You don't need any stress. Let's eliminate all the stress, because
exactly.
You have a lot going on. And so with that, besides your father and your husband, what other support system did you have the moment you learned about your diagnosis, I should say?
I'm so fortunate. I had so much support. My sisters are like my best friends. I have best friends who are like my sisters, and I have a nice big extended family. So I had a lot of people behind me throughout the entire process. I was very fortunate.
And that's very important, especially when you're going through anything. Having a support system, if it's friends or families or colleagues as well. And so I know you said you recreationally use it 2 or 3 times a year. And so did you have to get over any myths or misconceptions about the sacred plant or medical cannabis before deciding to use it? I know your dad was like, you need to do this. And can we talk about the type of ingestion that you used? Was it a tincture? Was it this edible? Was it smoking? Was it oils?
So it evolved.
Okay.
When I first started out, I used full extract oil. Rick Simpson protocol, though, is what I was doing at first. And that's what my dad's friend was doing. And that's what I found online. That was the most common thing I found online.
Yeah.
So I was at the very beginning just trying to get as much of this thick tarry oil in as I could. And I eventually learned how to make that into my own tincture, how to use smaller doses and all of that. But at first I was using these really high doses of cannabis, and the myths that I think I had to get through was that's what I had to do. And I've since learned that's not the case at all.
Yeah.
And there's also, when you go through breast cancer, anybody that goes online and looks up breast cancer and cannabis is going to come back with so much conflicting information that it just causes paralysis. So I had to get through all of those myths in order to get to where I am now in my understanding, for sure.
You know, Rick Simpson, he's gotten a lot of coverage. He's I guess, a fellow Canadian. And we have a lot of families and patients and doctors that come to us and they're panicked because they follow his procedure, his recommending, I guess, protocol, which is take a gram a day.
Mm-hmm.
I personally think that's way too much. I think cannabis is not a one size fits all. You know, you need to look at age and weight and current health condition of the patient, as well as any medications and the type of cancer. Breast cancer, I mean, there's so many different types of breast cancer that they're not all treated the same. And I'd love to get your thought and opinion on that as well.
Mm-hmm.
You know, Rick Simpson treated himself for skin cancer, not breast cancer, not pancreatic, not brain, not lung. And it doesn't say anywhere with his 1 gram method of ingestion, is it for a 2-year-old child or is it for someone in the Canadian Football League or the American Football League?
Right.
You know, and so how long? Because a gram of oil is a lot, and it'd be like you and I having a glass of wine or a beer today and 2 jugs of whiskey tomorrow if we took a gram. And so
right.
and it's a pretty uncomfortable feeling. And so with his protocol, which was a high THC, is that what you used? Or were you just trusting the plant that you grew in the backyard that didn't have any testing of formulations, dosing, metals, pesticides? You know, you didn't have that. And again, it's kind of what Corinne and I did with her father. You know, it was trial and error, the blind leading the blind. And, you know, with that, we didn't have any error. And it sounds like with you, you know, the outcome has been incredible. And have you changed your protocol since then from 2 years ago to today?
Definitely big time. I've changed my protocol.
Okay.
Originally, the plant that I got was, I just had to trust that somebody knew that it was the right amount of THC and CBD to make the oil. The family friend taught me how to do it using a distiller, like kind of like a green oil machine kind of thing. And we did send it away to have it tested because I was just really paranoid about it. Everybody was telling me, oh, you don't have to worry about the THC and this, but I wanted to know what was in it. So I did do that. But in terms of the high doses that I was taking, even though it was a balanced strain of CBD and THC, it was still really high doses of THC. And so it caused a lot of anxiety. I didn't feel good. You know, cannabis has kind of like a bell curve in terms of how it affects you. A little bit is good, a moderate amount, you kind of hit your Goldilocks zone. But for me, that high dose protocol was not right. And I can tell the difference because from my first chemo treatment, I ended up having actually a lot of pain. I think maybe even more pain than had I not used it. I don't know for sure, but I had a lot of pain. And I think it's because my mental state wasn't right. I was really anxious, right? I didn't feel good at all. And then with my second chemo treatment, which was just 3 weeks later, I had time to kind of step back a little bit and reevaluate. And I started taking smaller doses, microdosing throughout the day.
Good.
And I could see such a huge difference between that first chemo and the second chemo.